What is lumbar decompression surgery? How long does surgery take? And what does the recovery period look like? Hi, I'm Andrew Frost, consultant spinal surgeon at the Albyn Hospital, part of Circle Health Group. Today, I'll be answering some of your most commonly asked questions about lumbar decompression surgery. I've performed this surgery many times throughout my career, so if you yourself are struggling with spinal problems, you're in the right place for answers. So, let's begin the video. First things first, what is lumbar decompression surgery? Lumbar decompression surgery, also known as lumbar decompressive laminectomy or spinal decompression surgery, is a surgical procedure performed to relieve pressure on the nerves in your lower spine. This pressure can lead to unpleasant symptoms such as low back pain, leg pain, numbness, weakness, and difficulty walking. Lumbar decompression surgery is recommended when other treatment, including medication and physiotherapy, have not successfully helped alleviate the pressure on your nerves. Why might you need lumbar decompression surgery? The most common reason why you might need lumbar decompression surgery is for spinal stenosis. This occurs when the spinal canal narrows due to age-related changes, which puts pressure on the nerves inside. The facet joints in the spine can swell when they become worn and arthritic. This can lead to the nerves being squashed by the arthritic joints. A herniated or bulging disc occurs when the soft inner core of the intervertebral disc in your back pushes through its tough outer layer and presses down on a nearby nerve. The bones of the spine can sometimes move and slip on one another, and this can cause narrowing of the canal that the nerves run through. All of these degenerative changes in your spine can result in pressure on your nerves. Other less common causes include accidents or injuries, such as fractures, dislocations, or trauma from severe impact to your spine. There are many reasons why you might need this surgery, but the sooner you get help for your symptoms, the sooner you can get the right treatment. How do you prepare for lumbar decompression surgery? It's important to follow your consultant's instructions regarding medications you may need to stop taking before the surgery. This could include blood-thinning medications and herbal supplements that could interfere with the anesthesia. We also recommend arranging a solid support system for you during your recovery. You may need help with daily activities, such as bathing and dressing yourself as you recover. Having friends and family to assist you can make a significant difference in your recovery and comfort levels. Since you will not be able to drive home immediately after surgery, arrange for somebody to drive you back home from hospital. Your healthcare team will ensure you have a detailed description of how to prepare for surgery. What happens during lumbar decompression surgery? During surgery, you will be placed under general anesthesia. Your consultant will make a cut in your lower back and use specialized tools to remove any bone spurs, damaged tissue, or herniated discs. They may also use screws, rods, or other devices to stabilize your spine and keep it in a proper alignment. The overall duration of the surgery can vary depending on the severity of the condition, the technique used by your consultant, and other factors. What are the different types of lumbar decompression surgery? Three of the main procedures used for spinal decompression surgery are a laminectomy, where a section of bone is removed from one of your vertebrae to relieve pressure on the affected nerve, a discectomy, where a section of damaged disc is removed, and a spinal fusion, where two or more vertebrae are joined together with bone graft. Each surgery has a different technique and recovery period. What is the recovery period like after lumbar decompression surgery? The duration of your recovery period will vary depending on the type of surgery performed, your overall health, and other factors. It can take from 4 to 6 weeks for the general pain and tiredness after your operation to improve. You'll usually feel well enough to leave hospital around 1 to 2 days after having your surgery, depending on which surgery you had and how mobile you were before surgery. Most people can walk unassisted within a day of having surgery, although more strenuous activities will need to be avoided for about 6 weeks. Physiotherapy after lumbar decompression surgery is a crucial part of your recovery process. It involves working closely with a physiotherapist who will assess your range of motion, strength, and overall activity. Physiotherapy can vary depending on the type of surgery you had, but it typically involves a combination of specialist exercises and stretches to help you regain your strength and flexibility. During physiotherapy sessions, you might work with equipment like resistance bands, exercise balls, and balance boards. When can you return to work after lumbar decompression surgery? It's important to note that the return to work timeframe for lumbar decompression surgery can vary significantly. Some people may be able to return to work within a few weeks, while others may require several months off to fully recover. Factors that can impact this timeline include the type of job you have, the technique used by your consultant, and your overall health. When can you exercise properly after lumbar decompression surgery? Follow your doctor's individual advice about returning to exercise, because they will know about your individual circumstances and how to tailor these exercise plans to these. Once you've been given the green light to exercise, it's important to start slowly and gradually increase the intensity and the duration of your workouts. It's important to listen to your body and not push yourself too hard too soon. If you feel any pain or discomfort, it's important to stop the exercise and speak with your consultant before continuing. So there you have it, a run-through of lumbar decompression surgery. If you'd like to discuss lumbar decompression surgery in more detail, you can book an appointment with me or your nearest consultant at circlehealthgroup.co.uk. We hope you found this video useful, and don't hesitate to leave any more questions in the comments section below.